Hello everyone. Today is World Glaucoma Day, and you would be surprised that in spite of so many efforts, many people are still not aware that what is glaucoma, what symptoms it has, and what are its bad effects, what it can cause, what the damage, and where actually the disease exists. Yes, so let me tell you, glaucoma is the second largest cause of permanent blindness. Yes, it causes permanent blindness if it is not treated well in time. So, for glaucoma, we can say definitely that prevention is better than cure. Timely assessment and screening of the patients is important to prevent blindness due to glaucoma. The first cause of blindness is cataract, but cataract is curable by a surgical process and it is cured permanently. But glaucoma is not curable. It is only preventable. Over 3 million people in the world are blind due to glaucoma. So let me tell you what it is and what symptoms it carries. So glaucoma actually is a disease in which the pressure inside the eyeball increases, and this increased pressure causes bad effect upon the nerve specifically, which carries the sensation of vision from the back of the eye to the brain. So as time passes by, if this increased pressure is not controlled by medicine or many other processes like laser therapy, the constant increased pressure causes pressure upon the optic nerve, the nerve behind the eyeball, and as time passes by, the nerve compresses, it becomes atrophic, it dries up, and finally it can lead to permanent blindness. So the second thing which is important to be known is who actually are at risk of glaucoma. So glaucoma, although it can happen to newborn babies, it can be congenital, but the more common glaucoma cases, the more danger occurs after 40 years of age. People after 40 years can have a risk of glaucoma, specifically if they are having a family history of glaucoma. Second thing, if a person is diabetic or having high blood pressure, such people are more at risk of having glaucoma. So, it is advisable that a person after 40 years should have a dilated eye examination once in every 5 years at least, even if he has no systemic disease, he is not hypertensive, he is not having high blood pressure, he is not having diabetes, and even if he has no family history of glaucoma, that means his parents, grandparents, or siblings, or elder brothers and sisters, even if they are not having glaucoma, still every person after 40 years should have a dilated eye examination to screen whether he is glaucomatous or not. But if a person is already glaucomatous, if he is under treatment, he should advise and follow the instructions of the ophthalmologist, how often he calls him, once in 3 months, or maybe once in 6 months, or once a year. He should definitely follow the advice of the ophthalmologist. The drugs whichever he advises, he should use those medicines regularly. Talking about those who are actually not glaucomatous, but they are hypertensive, they have high blood pressure, they have high blood sugar levels, or they have a family history of glaucoma, then such people should have an eye checkup, a dilated eye examination once in 1 year or at least 2 years, as advised by the doctor. Even if a person is not already glaucomatous, then too. As I told you, only prevention is the method to prevent to prevent blindness due to glaucoma. So, once a person is assessed to be glaucomatous, the ophthalmologist may advise a series of tests to know the extent of damage which glaucoma has caused within the eyeball, within the layers of the retina, or within the optic nerve. Talking to the symptoms, the patient, what he will face, what difficulty he will face. So actually, there are two types of glaucoma. One is angle closer glaucoma and the other is open angle glaucoma. So, those having open angle glaucoma do not have any symptom. It is a silent thief of vision. If a person is not screened in time during routine examination or otherwise, he might not know that he is glaucomatous. And when the bad effect occurs, actually, when the damage has been occurred, the patient's field of vision, the extent of the vision that he can see around, the concentric diminution in the field of vision occurs. The person may have good vision in the central vision. He may have perfect vision in the front, but the field of vision which he can see all through the 360 degree, that decreases. And if he doesn't come to know in time, it decreases and then decreases and further decreases, and then it can cause permanent loss of vision. Coming to the other type of glaucoma, the angle closer glaucoma. It can cause pain in the eyeball or pain in the supraorbital region or headache. The pain may be severe or it may be mild. So, even if you are having off and on headache or pain in the eyeball, do not ignore. Get an eye examination done. It may be due to glaucoma also. The other symptoms which are like glare, photophobia, that means when you look to some bright object, it causes glare, you feel discomfort in the vision. There may be some fall of vision, of course, but there are other causes also of fall of vision. So, only a detailed eye examination, a dilated eye examination, after that only you can know that is it due to glaucoma or not. So, now coming to the treatment, there are various modalities of treatment, various modes of treatment, like there are certain medicines and the person may have to use those medicines, those eye drops throughout the life, as a person uses long-term therapy for high blood sugar, high blood pressure. Similarly, glaucoma may need constant medication. This is the only way to prevent damage, to prevent blindness that occurs due to glaucoma. The other treatment modalities are, there may be, the ophthalmologist may advise laser procedures or surgical procedures also. As laser has advanced, the need for surgical procedures has declined, but yes, the decision will be made by your ophthalmologist. So, at the end, I would definitely like to advise all those who are above 40 years, specifically if they are having a family history of glaucoma, or if you are hypertensive, if you are having diabetes, do not ignore your eyes. Get a dilated eye examination done to rule out glaucoma, and also the ophthalmologist will rule out whether you are having any retinal damage due to high blood pressure or diabetes. So, I suppose this information may save many people from loss of vision. Do share my video to all your friends and relatives, as it is a very, very important and very informative video. Mind it. And please let me know what else you want to hear from you. So, take care and have a good day.